What would you do if your child started choking on a fever and the doctor, instead of diagnosing him, opened a vein to let out the excess air? In the Middle Ages, medicine was not a science. It was a mixture of faith, fear, and despair. People died not because the disease was incurable, but because no one knew what it was. Doctors in cassocks, with leeches, with knives and prayers, treated by relying on the stars, the taste of urine, and the position of the moon. Pain was God's way of reminding man of sin. And the cure? Sometimes just a bundle of herbs, sometimes a red-hot iron. Have you ever wondered what it would be like to fight for your life with no one right answer? Stay tuned. Now you're about to find out what healing was really like in the Middle Ages. In the Middle Ages, illness was perceived not as a biological malfunction, but as a divine message, often terrible and incomprehensible. The church taught that illness was a punishment for sins, a sign that a person's soul had strayed from God's path. Healing began with spiritual practice, not with medicine, but with prayer and repentance. People went not to a hospital, but to church, to the altar, to relics, to holy relics, which were believed to be able to stop the disease. The priest became the first doctor. He took confession, absolved sins, and prescribed prayer practices. In such cases, psalms were recited over the patient, consecrated objects were placed on the body, and the power of relics was relied upon. The Bible became a healing tool. Its pages, sometimes even literally, were applied to the body of the sufferer. Spiritual cleansing was seen as a prerequisite for physical healing. A significant number of doctors at that time were priests, the only ones who had access to knowledge and could read Latin texts. They combined religious practice with remnants of ancient medicine, but prayer was considered the main treatment. Treatment included fasting, bowing, vow-wearing, and pilgrimages to propitiate the higher powers. Even epidemics like the Black Death were attributed to the sins of society, not to living conditions or infections. Disease was seen as a collective punishment, and so mass processions and all-night services were organized. Some saw suffering as a sign of chosenness, an opportunity to come closer to God through pain. Monasteries served not just as shelters, but as spiritual hospitals, where body and soul were cared for at the same time. Prayer, silence, and humble food were considered more important than any infusions and ointments. People believed that healing could come not from the hand of a doctor, but through a revelation in a dream or a divine sign. Even kings and nobles sought help from the saints when sick. They brought gifts, built chapels, and made vows. Healing springs and places of apparitions were considered to be especially powerful, and patients were taken there from faraway lands. Without the blessing of the church, any treatment was considered dangerous and sometimes heretical. Thus, a special worldview was formed in which the body was only a shadow of the soul, and true healing began with repentance. A doctor without prayer was considered blind, and medicine without faith was considered empty and perhaps even harmful. Illness was not just a test, but a spiritual challenge, a test of fortitude and faith in God's providence. For many centuries, the basis of all medicine was the theory of four fluids, or humors, developed by Hippocrates and developed by Galen. Blood, phlegm, yellow and black bile were considered vital principles, on the ratio of which depended on the physical and mental state. Health was determined by the balance of these juices, and disease by a disturbance of their proportions caused by lifestyle, diet, or season of the year. For example, an overabundance of blood, according to the ideas of the time, made a person overly cheerful and excited, causing fever and inflammation. Excess phlegm was associated with lethargy, drowsiness, a tendency to colds and mental retardation. Yellow bile, if it became too much, gave rise to anger, headaches, rashes, and abdominal pain. Black bile, the most mysterious and gloomy of the juices, was associated with melancholy, prolonged ennui, and even obsession. Diagnosis was reduced to observation of skin color, taste in the mouth, sleep, behavior, defecation, and even dreams. The doctor had to feel the body temperature, study the pulse, and make a diagnosis based on weather conditions and the phase of the moon. Bloodletting, from vein dissection to the use of leeches, was used to rebalance the humors. Blood was considered the most mobile juice, and its excess was eliminated most often, especially in fevers and inflammations. Almost every self-respecting healer had knives and vessels for collecting blood, and knew from which vein and in what disease it was better to let it go. In addition to bloodletting, vomiting and laxatives were used to cleanse the body of excess mucus or bile. Herbs, decoctions, powders, and even animal substances were used to awaken certain fluids. Sometimes the opposite was practiced. If the juices were lacking, a diet was prescribed, which helped to make up for the missing element. Skin diseases, for example, were interpreted as an external manifestation of internal rot, usually an excess of yellow bile. For colds, warming infusions were prescribed to expel phlegm, and sweating was increased with hot baths. Mental abnormalities were attributed to the excessive presence of black bile and treated with isolation, sleep, and herbs to induce sweating. Even the choice of time for treatment depended on the humoral theory. Some procedures were carried out only on the waning moon. One could not treat in the hour of fire if the disease is associated with overheating or prescribe bloodletting in humid weather. The healers possessed the fine art of matching the character of the patient, the seasons of the year, and the manifestations of disease with the doctrine of the juices. Yellow bile prevailed in summer, phlegm in winter, blood in spring, and black bile in fall, and each season had to be prepared for. Diet, sleep, physical activity, and even sexual intercourse were regulated by taking into account the internal balance of the juices. Galen created extensive treatises in which he described the properties of each juice and offered hundreds of recipes for their ordering. Although such a theory sounds archaic today, it is the theory that gave rise to systematic diagnosis and individualized medicine. Medieval doctors did not know about germs, but tried to find logic in the chaos of suffering with the tools they had in their hands. In medieval medicine, bloodletting was considered almost the main way to restore the body's lost equilibrium. And if a person was sick, injured, or complained of fever, headache, or weakness, the first thing the doctor did was to get a knife or a leech. Even in the case of a serious wound, when the patient was already losing blood, it was considered wise to let the spoil out to relieve suffering. Medical knives, often sharply honed lancets, were the pride of the doctor, like a knight's sword, and were carefully cared for. Along with knives, horn tubes were used, through which a vacuum was created to draw blood from the vein. But leeches were especially valued. Dried or live, stored in clay jars, purchased from peasants and even smuggled from the marshes. The leech was attached to the body, usually in the neck, ear, or forearm, and began sucking blood, injecting an anticoagulant. This caused a slight burning sensation, but patients tolerated it, believing that the bad blood went away with the pain and sin. One treatment could last from 20 minutes to an hour, and afterwards the patient was bandaged with a linen bandage containing a garlic infusion. Sometimes bloodletting was performed up to 1.5 to 2 liters in one session, almost a third of the circulating blood volume. It was believed that the more severe the illness, the more should be released, especially in fever, inflammation of the lungs, or attacks of madness. Doctors made incisions not only on the hands but also behind the ears, on the ankles, and even in the groin area, depending on the diagnosis. Paradoxically, patients often actually felt temporary relief after the procedure, due to a decrease in blood pressure. This strengthened faith in the method, and bloodletting was prescribed even for fatigue, overeating, or bad moods. Even monks, obliged to observe moderation, practiced blood fasting once a season, considering it part of bodily purification. Leeches were especially popular in monastic infirmaries and with wealthy townspeople, where they were bred in special ponds. One leech could be used no more than once. Then it was thrown away or burned. They feared the spread of disease. Some doctors carried leather cases with a set of leeches sorted by size and appetite. Ordinary people were also encouraged to leech. Folk healers often did it at home, without much medical knowledge. There were entire calendars of bloodletting. On what day, in what sign of the zodiac, and phase of the moon it is safest. Doctors Galen, Avicenna, and other ancient authorities emphasized the importance of the right time of day, most often early morning. However, there were also critics. Some healers warned that excessive bloodletting weakened the heart and spirit. It happened that patients died from loss of blood, especially if they were already exhausted by illness or starvation. Nevertheless, until the 18th century, the practice was considered the norm and hardly questioned, especially in military medicine. Bloodletting entered medical treatises as the first and primary method of treatment, along with diet and bowel cleansing. It was a universal prescription for everything from childhood colds to senile marasmus, and despite its archaic nature, it came to symbolize an entire era of medicine, seeking order in the chaos of pain and fear. In the silence of monastic walls, behind thick stone walls, not only the word of God was kept, but also knowledge that saved from pain. Benedictine, Cistercian, and Augustinian monasteries in the Middle Ages became strongholds of medicine when secular science was declining. Here, among candles, parchments, and prayers, they copied Galen's and Avicenna's treatises, wrote down new observations, protecting them from oblivion. Each monastery had its own apothecary garden, a fenced plot of land where dozens of species of medicinal plants grew on beds. There they tended sage, mint, fennel, burdock, chamomile, willow bark. Each herb had its own purpose. The monks not only grew herbs, but also knew what phase of the moon to harvest, how to dry them, and how to infuse them properly. In the cells, they prepared decoctions and infusions. Valerian root for fever, poultices with wormwood and honey for boils, and thyme for coughs. Cilantro was used to cleanse the skin, and sage was used as a gargle for toothache and sore throat. Each recipe was recorded in special books, herbariums and healing books, which were then passed on to other monasteries. There were special herbal calendars, which indicated not only the time of collection, but also the appropriate prayers for each case. The treatment was accompanied by spiritual support. The patient recited psalms, blessed the decoction, and asked the saints for intercession. The monks believed that herbs cure the body and prayer cures the soul, and one without the other does not bring complete healing. The writings of Dioscorides and Pliny the Elder, as well as anonymous recipes passed down over the centuries, have been preserved thanks to scribes. Women's monasteries also practiced healing. They grew oregano, althea root, and dried rose petals for ointments. Often the abbesses themselves became respected physicians whose advice was sought even by knights and kings. Some monasteries were so famous for their medicine that pilgrims went there not only for forgiveness, but also for healing. The monks made observations: how many days the fever lasted, how the pulse changed, what potions gave results. This was rudimentary but real scientific thinking, through the prism of faith and observation of the body. In the absence of state medicine, it was monasteries that created the first prototypes of hospitals, hospices attached to churches. They treated not only brothers, but also the poor, travelers, widows, and orphans, anyone who came for help. Sometimes a monk herbalist was more famous than a city doctor, especially if he had a gift of the hand and could treat fevers. Monasteries in the Alps and the British Isles were especially famous. There, the climate and soil allowed the cultivation of rare herbs. In Scotland, Ireland, and Wales, monks even collected seaweed, dried it, and used it for wounds and burns. Some herbs, like mandrake, were surrounded by mysticism, and their collection was accompanied by elaborate rituals. Monastic medicine was often at odds with military medicine. If a doctor tried to treat with bloodletting, a monk would advise rest and linden tea. Herbalists criticized the overkill of surgery, preferring wraps and baths with decoctions of pine and St. John's wort. Although scientific precision had not yet arrived, it was the monasteries that became the bridge between ancient wisdom and the coming medical renaissance. Medieval surgery was not so much an art as an act of desperate courage for both doctor and patient. When an arrow or a spear was thrust into a body, the question was not about the accuracy of diagnosis, but about survival in the coming hours. The wounded man was laid on boards, tied with straps, and then, without asking, cut, quickly, decisively, brutally. The operations were carried out in any suitable places, on dirty cloaks, in the shadow of walls, under the whisper of prayer and the squeal of pain. On the battlefield, the surgeon worked on his knees, surrounded by blood, fear, and silence, when time ran out in seconds. In monasteries, on pews and altar stones, in villages and stables or barns that smelled of sweat and manure. Removing the arrows required not only strength, but also cunning. The tips were serrated and impossible to pull out. The surgeon would stick the knife in deeper, cut through the flesh, hook the iron, and then rip it out, often along with a piece of muscle. The pain was unimaginable, and often the patient lost consciousness and sometimes his sanity. There was no pain relief as such, just bowls of wine, soaked rags with opium, prayers, and teeth clenched until they cracked. Sometimes sticks or leather straps were placed in the mouth to prevent biting the tongue and swallowing a scream. Vapors of vinegar were used to awaken the mind, and sometimes as a mild antiseptic for wounds. In amputations, the axe or saw, not the scalpel, was decisive. The limb was cut off quickly in a few rough movements. Bleeding was stopped by cauterization with a cauterized iron, which was driven into the flesh with a hissing sound and the smell of burning meat. It was under these conditions that turnstiles were first used to slow the flow of blood. Abscesses were opened with iron probes and sharp knives, sometimes with nails or an awl. The pus was drained onto the straw, and only then was the cavity washed with wine or herbal tincture. If the patient experienced a fever, it was believed that the body was cleansed of evil, and it was even considered a favorable sign. Surgeons were most often barbers, men who could shave, cut, and shear without a university education. They wore leather aprons, dirty with blood, and moved around with a set of iron like a blacksmith with his tongs. The surgeon's handwriting was not in neatness, but in speed and determination. Seconds decided the fate of the wounded. Many did not survive the operation itself, but if they remained alive for 3 days, the chances increased dramatically. Immunity and simple luck played a huge role. There were no antibacterial remedies other than garlic and alcohol. Nevertheless, it was these crude practices that eventually formed the basis of future surgery when the axe was replaced by the scalpel. While Europe was drowning in the darkness of epidemics and prayers, the East was already storing volumes of medical knowledge in its libraries. Arab physicians such as Avicenna and Rhazes did not just treat, they systematized medicine, turning it into a science. The Canon of Medicine by Avicenna, a 5-part work written in the 11th century, became an encyclopedia for generations of doctors. But the path of this knowledge to Europe was long, thorny, and politically dangerous. The Catholic Church was wary of anything coming from the Muslim world, especially pagan science. It was believed that true healing could only come from God, and any books outside of Scripture were suspect. Nevertheless, translators in Toledo and Palermo, often Jews and Arabic-speaking Christians, began to translate the works of the East. From the 12th century, Latin translations of the Canon, Galen, and even Aristotle began to appear in European monasteries. This was an intellectual breakthrough. For the first time in centuries, Europeans saw medicine based on logic and observation. One of the first European schools to embrace this knowledge was the medical school in Salerno, Italy. Founded in the 10th century, it combined the knowledge of Arabs, Greeks, and Jews, becoming the first bridge between East and West. Even women taught there. The famous Trotta of Salerno wrote works on gynecology ahead of her time. The next center was Montpellier in France, where medical training already included Arabic anatomy and pharmacology. Montpellier received students from all over Europe, and many left with leather-bound copies of Oriental treatises. Thus, the ideas of balance, pulse diagnosis, urine monitoring, and infusion therapy became part of Western medicine. Yet the Church had long controlled the boundaries of what was permissible. In some regions, the study of pagan writings was forbidden. Medics were often interrogated by the Inquisition if Arabic or Jewish characters were found in their books. Therefore, some works were rewritten with Latin names to disguise their origin. Despite this, through crusades, trade, and cultural exchanges, Arab medicine made its way into hospitals and universities. Not only Avicenna, but also Rhazes, who described measles and chickenpox 800 years before Jenner, were particularly popular. Also, his methods of disinfection, based on vinegar and alcohol, became the basis of sanitation practices in Europe. Thus, it was the East that became the forgotten source that woke Europe from its medical slumber. And though the journey was long, difficult, and dangerous, this knowledge survived in translations, manuscripts, notes in the margins, and perhaps it was they who became the foundation of the medicine we know today. Accurate, but born out of darkness. Medieval doctors and healers often relied not only on herbs and knives, but also on the power of symbols, believing that holy relics and amulets could protect the patient from evil spirits and illness. Crosses, images of saints, and chains with relics suspended from necks could be found in the homes and wards of the sick, all considered an important part of healing and spiritual protection. The belief in the magical power of talismans was so strong that sometimes more trust was given to them than to physical medicines, because illness was seen as not only bodily, but also spiritual evil. An important role was played by astrology, widely recognized as the science of the time, where the position of the stars and planets determined favorable and unfavorable moments for treatment and surgical operations. Many doctors in their notes indicated the exact time when the moon or Mars occupied a particular position in the firmament. It was on this that the success of the procedure depended. The calendar of operations, calculated by the stars, was an integral part of the preparation for treatment because it was believed that the celestial bodies affect a person's health, his blood, and even the nature of the disease. Diagnoses were often made on the basis of the patient's horoscope, where not only the date and time of birth were studied, but also the current position of the planets, which made it possible to predict the course of the disease and its outcome. For example, if the sun was in the sign of Cancer, the disease was associated with the stomach and digestion, and the position of Venus indicated problems with the skin or reproductive system. Such a system looked mysterious and incomprehensible to the modern eye, but in the Middle Ages it was a central part of medical practice and educational programs. Amulets were often accompanied by spells and prayers recited by priests or witch doctors to enhance their power, making the treatment both a medical and religious rite. There were known cases when a sick person was tied with threads with images of saints or wore on his body small bags with herbs and written prayers to ward off the disease. In some regions of Europe, there were even special masters, spellcasters, whose task was to create such amulets and conduct healing rituals. And although today's medicine has long abandoned this approach, one cannot but recognize that in those days, these methods brought patients not only comfort, but also psychological support. Belief in the power of amulets and auspicious stars removed the fear of illness and death, and often it was this inner calm that helped the body to fight the disease. Thus, medicine of the Middle Ages was a unique fusion of science, faith, and magic, where each element played its role in a complex system of healing. Ultimately, amulets, spells, and astrology were an attempt to explain the unknown, to find a foothold in the chaos of illness and death. And while modern man may consider it superstition, for the medieval patient, it was a real chance of recovery. These practices were preserved for centuries, passed down from generation to generation, and at the same time became part of the cultural and religious heritage of the era. And even today, among those interested in the history of medicine and mysticism, medieval rituals arouse genuine interest and admiration for the way the human mind sought answers in the stars and sacred objects. Medieval medicine was a complex and heterogeneous world where there were university-educated physicians, village witch doctors who passed their knowledge by word of mouth, and peddlers who sold miracle potions and promises of healing. Medical scholars often studied at the universities of Salerno, Montpellier, or Bologna, where they studied the works of Galen and Avicenna and drew on classical medicine and natural philosophy. But even they could not always explain the causes of disease, resorting to the theories of the four juices and stellar astrology. At the same time, village herbalists relied on folk recipes and herbs, could read the signs of nature, and often combined treatment with religious rituals, which made them extremely popular among commoners, especially in remote parts of Europe. Trust in a doctor in those days was determined not so much by his knowledge as by the confidence with which he spoke and acted, and by his reputation in the community, for the lack of modern tests and laboratories forced patients to rely on charisma and charm. Barbers, those who practiced bloodletting, simple surgery, and wound care, were often jack of all trades, but lacked systematic medical knowledge, and yet were in demand in towns and villages. Many sick people, especially during epidemics, fell victim to charlatans who sold magic pills, amulets, and tinctures promising instant cures, and often gathered crowds around their tents. Healers and barbers often risked their reputations and even their lives trying to help in circumstances where Even a small wound could lead to a fatal infection. Charlatans, on the other hand, played their role in society, offering comfort and hope, albeit false, which was often important for the psychological state of the sick. The Black Death, or Plague of the 14th century, has forever gone down in history as one of the worst catastrophes of mankind, sweeping across Europe and killing up to 60% of its population, bringing with it unbearable fear and a sense of absolute powerlessness in the face of disease. Doctors and herbalists of the time were deprived of the means and knowledge to fight the plague, and traditional methods of treatment, bloodletting, herbal infusions, and prayers, proved useless, leading to mass panic and despair among the population. In response to the epidemic, ominous beak masks filled with aromatic herbs and spices appeared, worn by medics trying to protect themselves from evil air, one of the dominant theories of infection at the time. The windows and doors of houses were sealed to prevent the entry of disease-causing forces, and the streets were deserted. People were afraid to go out and come into contact with each other, but nevertheless the infection spread rapidly thanks to fleas and rats, invisible to the eye carriers of the contagion. Herbal smoking in homes and monasteries was seen as a way to purify the air, but these measures were more of a comfort to the mind than a real defense. For an accurate understanding of the mechanism of disease transmission did not emerge until centuries later. Doctors, despite all precautions, were often among the first victims of the epidemic because they were constantly around the sick and had no way to fully protect themselves. People looked for culprits, Jews, beggars, sinners, and others, and organized pogroms, which only added to the chaos and division in society, making it impossible to unite against the real threat. The plague was not only a biological, but also a cultural catastrophe that profoundly changed perceptions of life, death, and medicine, raising questions for humanity about the limits of knowledge and power. Despite the horror and scale of the disaster, it was during these years that the first sanitary measures, quarantine, isolation of the sick, and control of the movement of people, appeared, which eventually became the foundation of epidemiology. Medieval medicine is not just a set of naive ideas about disease, but a testament to man's incredible perseverance to survive, even as plague, famine, and war raged all around. The people of that time didn't have microscopes, antibiotics, or an understanding of infection, but they possessed something else, an unbreakable will to seek ways to alleviate suffering, even if those attempts seem doomed from today's perspective. Every drop of infusion, every bandage, every appeal to the saints is not only a gesture of desperation, but also a manifestation of the deeply rooted human instinct to help and save. The medical practice of those years teaches us the main thing. Survival is possible not only through technology, but also through the willingness to act, adapt, learn from our own mistakes, and accumulate collective experience. When doctors, barbers, and even simple village women and herbalists tried to heal the sick, they did so with the belief that every effort mattered. And it was this mindset that helped humanity survive the worst of the ages. The medieval man improvised. If one thing didn't help, they tried another, observed, drew conclusions. And over time, this developed into a proto-medical tradition from which we, strangely enough, still inherit much. A sage infusion may not have cured the plague, but it alleviated fever. A poultice of wormwood may not have cured infection, but it could relieve pain. And there was power in that too. Help here and now, when there was no other. History has preserved examples of village healers saving wounded soldiers on the battlefield by dressing wounds with cloth soaked in wine or vinegar. And these primitive antiseptics were sometimes more effective than inaction. Even in the face of total fear and lack of knowledge, they did not give up. Monks prescribed tinctures based on Avicenna's recipes, passed down through Arabic translations. Herbalists sought out new plants, and ordinary people relied on what worked. Faith played an important role. It gave meaning to suffering, it strengthened the spirit, and in survival conditions, psychological resilience meant as much as physical healing. A peasant who believed that wearing a relic would protect him from illness could be more organized, less prone to panic, and this in turn affected his chances of survival. It was this kind of faith, albeit naive from our point of view, that provided people with inner support, especially when science had not yet been able to provide it. Medieval medicine is not a museum of error. but a trove of lessons about how the human mind, even in the darkest of circumstances, continues to seek and create. We see in them an example of how, without laboratories and universities, the foundations of future science were formed, and how any attempt to help, even an inept attempt, could be the first step towards medical progress. People did not wait for the perfect moment, they acted, and it is this ability to act that is the most important element of survival in disasters. The physicians of that time were sometimes wrong, sometimes misguided, but their persistence, their constant attempts to treat, their insistence on finding explanations is what brought them in common with modern physicians. Their example teaches us not so much a medical truth as an attitude, not to pass up in the face of the incomprehensible, not to give up when there is no answer, and to do the best we can with what we have. In this sense, medieval medicine is as much a story about illness as it is about courage. The courage to treat when you don't know how, the courage to hope when everything says otherwise. This era has shown that survival is not for those who know everything, but for those who are willing to learn, to change, and not to give up the fight, even when the chance of success is slim. It was from a mixture of faith, improvisation, pain, and experience that the medicine that today saves millions was born. And in this, we must recognize the merit of those who fought before us. The story of medieval physicians is not about defeat, but about how with each wound, with each infusion, with each confession, they brought the world closer to the realization that life is not only suffering, but also the search for meaning even in it. Medicine of the Middle Ages is not just a dark page of history, it is a mirror of human will, survival instinct, and the desire to understand where there is still no answer. Yes, they didn't know about bacteria, didn't have anesthesia, didn't know how to sterilize instruments, but they treated. They treated because they couldn't do otherwise. Behind every bloodletting, behind every herb, behind every prayer, there was not just fear of death, there was hope. We laugh at the mass of the beaks, but we forget that they were worn by those who still went to the dying when others fled. We condemn barbers, but they were the ones who grabbed the knife when no one else would. They were people who fought without even realizing what they were fighting, and they earned respect for it. Their world was cruel, their knowledge was limited, but their attempts to heal were real. And in a world full of pain and fear, that was already a feat. And if we live today in the age of vaccines, antiseptics, and MRIs, it is only because someone once did not give up in a dirty hut or a field drenched in blood. Subscribe to our channel so that we don't forget where we came from and why, despite everything, we keep going.